a case of a trauma to his right index finger, and the patient came with me with a cut like this, and you can see all the tendons and the arteries. They are just opened up right now. I'm going to do a surgery for this patient, and within 10 to 15 minutes he'll be perfectly alright. And there is also a foreign body inside this particular lacerated wound. You can see the black colored lesion over here. That's a small sand mica piece that's lodged inside the wound, and he's bleeding a bit, but we'll cauterize the whole bleeding, and we'll stop and we'll suture this, and I will show you how he will get here after the procedure. Now you can see me, I'm doing a interrupted suture with a non-absorbable. You can use two things. We can use an absorbable suture as well as a non-absorbable suture. I'm starting from this corner right now, and you can see a lot of bleeding that's going on right now, and simultaneously we are going to correct the bleeding during the ligature procedure itself, and once we finish the procedure, the bleeding automatically stops. Pause. Now you can see how nicely the wound is being closed, and there is a mild amount of bleeding that's going on right now, and I'm trying to make a very good hemostasis, and once the hemostasis is established, there will be a perfect closure of the wound. I'm just using a forceps, a simple one, because it was an emergency. I had to just rush the patient, and we are doing this procedure to immediately stop the bleeding and see to that the wound is closed and person is alright. And during this entire procedure, you can see there is no cry or hue from the patient, because we have given a local anesthetic right now, and there's a very good hemostasis that's being established right now. And you can see this, and I'm going to show you a close-up right now, how nicely the wound is being closed. There's a bit of slight bleeding over here. I'm going to finish this, and I'll show you how it looks once it's completely done. This is how his finger looks right now after the procedure. I'm going to show a close-up. Beautiful ligature that's being done here, and the patient's fingers become normal. Actually, the tendon was cut here, and if this procedure wouldn't have been done, he wouldn't have been able to use this finger very easily. Right now, what we have done is a double flap suture, and the tendon has been united, and all the muscles have been covered, and also the superficial part of the skin is closed, and now it's perfectly alright. Thanks for watching the video.